All right, thanks so much. It's really very exciting for me to be here. I have been trying to educate myself on a lot of the work going on out of development economics around IPV and around violence. And so to be in a room, well, sort of in a room, together with many folks who are new to me, I really appreciate that opportunity. So what I really wanted to try to do today is just to create a little bit of common understanding of the different perspectives that are in the room and the different kind of historical trajectories of work on cash and violence against women and particularly intimate partner violence. And then to sort of do a landscaping of what do we know now? So what is our starting point? And then to say just a bit about why I think and the Cash Collaborative thinks that this work is both really important for violence against women and also a really productive area for collaboration between the social protection field and the wider field of gender and violence. So it's intriguing to me that cash and these issue of cash transfers is really the one issue that has brought together a set of actors that have traditionally worked really quite siloed, or there may be collaborations across two of them, but very seldom three. And so the first is obviously the social protection field. And as most people in this room, I'm sure know, there's just been an enormous growth in the role of social protection as a mechanism for helping families deal with economic shocks and a real shift into the use of this tool by governments in Africa and Asia after decades of work in Latin America. I think we're seeing a real acceleration of this because of COVID, and apparently since March, there's been about 200 countries that have tried to step up some of their cash transfer social protection schemes in order to try to deal with the crisis of COVID. So there's over 1,000 new programs, or at least programs that were initiated or refined because of COVID. Parallel to this work, there's been a big emphasis in the last few years within the humanitarian sector about shifting a lot of the support to people and households in crisis, whether they be natural disasters or conflict, to actual direct cash payments. And what's intriguing about that is that there's a whole collaboration of folks working under the rubric of the Grand Bargain, which is 60 some odd organizations, governments, UN agencies, and large international NGOs that are trying to rationalize the field of humanitarian assistance. And one of the major work streams under that is is a work stream on cash and how to shift more of the support to direct cash payments. Intriguingly, there has been a lot of discussion around gender and cash in the context of this work stream. But with respect to violence issues, most of the concern there has very much been one of concern that the cash payments may be increasing risk to women of domestic violence or intimate partner violence. Whereas in social protection and the violence field, we've been talking some about the opportunities to potentially reduce risk. So the other area, of course, is violence against women and public health. I actually realized I pulled up the wrong presentation here, but I'll adapt here. So here, one of the things that's really important with respect to violence in the work on IPV is that it really has been very much dominated in terms of the research space by public health. People coming from that perspective, at least those of us who work on violence traditionally our training is in public health, and that's partly helped create a shift towards a greater emphasis on prevention as a complement to programs on services and support, which is where most of the emphasis has been until quite recently. There's been, not surprisingly, given what's happening in the development space in general, sort of an increasing demand for donors for evidence-informed programming and a real push to try to encourage scale. And so that in itself has directed our attention to things like social protection, which are being delivered at scale, and trying to understand if there are opportunities there in order to work more effectively at scale on violence. Most of the social protection programs, as most people will know, do not have as an explicit goal the issue of reducing violence, but we think that there are opportunities there that we could exploit, partly because they, even if the reductions are less on a household or a relationship level, because they touch so many people, there is the opportunity from a public health standpoint to have a much larger impact. And then finally, development economics, which as someone coming from public health, I've observed sort of the rise of both not only sort of more and more interest in randomized impact evaluations, but an increasing work stream amongst development economists of working on things besides economic well-being. So we're starting to see, a lot of work in nutrition and health and education, and increasingly on violence. So evaluating interventions whose explicit purpose is to reduce intimate partner violence or other types of violence in the family. So this graph gives you just a sense of the growth in IPV-related research and evaluation since 2000. I mean, we are seeing just an explosion of studies, again, largely driven both by interest of donors and helping to generate evidence. We have now over 100 impact evaluations of IPV-related prevention programs in the Global South. Most of these are randomized controlled trials or community randomized trials, with some of them, with some quasi-experimental studies, but there's been a strong emphasis on formal use of randomized impact evaluations. I think there's a mix of studies that have been purely quantitative, and then those where there has been embedded qualitative studies, both to look at process evaluations to see fidelity of implementation and the like, as well as to interview in depth different both key informants as well as beneficiaries to try to get a little bit of a handle on some of the mechanisms. And then there's a whole host of standalone kind of in-depth qualitative studies. So just briefly, thinking a little bit about the different theoretical orientations that are informing this space. And this is probably, it's definitely a gross simplification, but one of the things that I have noticed in terms of learning about the work going on in economics related to IPV is that there's a strong sort of emphasis in economics on testing different hypothesized theories of behavior. So what are the mechanisms? And then using, testing them against empirical data. So a real emphasis on trying to find those more universal, theoretically driven mechanisms that we can draw on for prevention. Public health kind of takes a different approach. It's very much builds an intervention or a program from a theory of change that has oftentimes multiple mechanisms and multiple theories that are informing it, and then evaluates empirically whether they reduce violence, and if they do, interrogates sort of the pathways through which they seem to be acting. Also, the kind of theoretical foundations are different. So, you know, in economics, most of the theories that are informing the economics world are based on variations on household bargaining models. And here, you know, women's power within a relationship or within the household largely depends on how credible her possibility to leave or her outside options. So frequently framed in terms of threat point is how credible is it that she could actually abandon the partnership that puts her at risk. There's also, I think, increasing use of framing the purposes of violence, either as men using violence for instrumental uses, so violence strategically to control allocation of household resources, or what is framed as expressive motivation. So men gaining some sort of utility from the violence, whether that's release of frustration or access to sex or getting their way. With respect to public health, most of the programs are built on a socio-ecological model. And what that looks like is kind of fundamentally, it says that violence does not have a single theoretical cause, but it's multi-causal and probabilistic. So that you have different risk and protective factors which operate at the individual or the interpersonal or the community or even the societal level that interact to increase or decrease the likelihood that violence would occur. So by analogy, you know, we think about heart disease, and there's no single factor that causes heart disease, but the more risk factors you have, if you smoke and you have a bad diet and you're overweight and you know, all of those things increase the likelihood that you might experience heart disease. And in this model, it's very theoretically promiscuous. So it pulls on theories from a lot of different areas, including behavioral science, but also other theories. So just to give a picture, I don't want to go through this, but it'll be in the slides of taking what is known in terms of risk and protective factors, specifically about intimate partner violence and putting them along the levels of the ecological model. And one of the things about this is that this is just a tool. So of course, it can be, you know, adapted to different types of violence, or also you can add different layers if it's important for a particular outcome. So what I want to do now is just give a sense of what we know with respect to the relationship of cash transfer programs and IPV. And this is really based on two things. One is a review that many consortium, or the collaboration, excuse me, did in 2018, and many of my co-authors are here in the audience. And this was a mixed method review of the impact of cash transfers on IPV in low and middle income countries. And what we did was really try to find anything that existed at the time, and also didn't just look at the findings of those particular studies, but try to excerpt from the qualitative and the quantitative studies what pathways or what mechanisms through which different authors were suggesting that there might be an impact. And from that, we tried to build what we call a program theory. So even if we don't have all of the, have evidence linking, for example, cash transfers to IPV, what are the steps along the way, and what are the literatures that we can draw on to establish the legitimacy or the viability or the likelihood of there being a relationship in those intermediate pathways. So just looking at the overall results from this 2018 review, is what we did is there were 22 studies in total. 14 were quantitative and 8 were in-depth qualitative. Sometimes actual qualitative studies of the same settings and programs that the quantitative studies were evaluating, and a few were standalone. And 11 of those 14 quantitative studies showed decreases in IPV. There were a couple of mixed, and what we mean by mixed is that might have shown a reduction, for example, in physical and sexual violence, but not a reduction or an increase in emotional violence. So that would be an example of a mixed study. And so there were 2 studies with sort of mixed results. And the impacts here range from about 11% to 66% relative reductions in IPV outcomes. There seem to be much more consistent impacts on physical and or sexual violence than on emotional abuse, or what we call controlling behaviors, which is behaviors by men to limit women's mobility or who she can see, or attend health facility, or those types of things. So when we were looking at the program theory, we came up with 3 possible pathways that seemed to be viable and seemed to emerge from the literature that existed at the time. And one was what we called the economic security and emotional well-being pathway, which I'll talk about in a little bit more depth, which operates at the household level. The second was a conflict model. So this was marital conflict, which is again happening at the relationship level. And then a women's empowerment mechanism, which happens at the individual level of women. So this first pathway is with respect to the economic security and how that leads to improved emotional well-being. So here what we see is there's a very strong literature where cash transfers lead to decreased poverty. And it does so through increased financial and food security and increased assets and savings, and that this actually helps improve coping strategies. So together, there's also a strong literature that reductions in poverty help promote emotional well-being or reduce mental health consequences. So you get improved mental health and decreased poverty-related stress. There's also, so if you think about those two literatures, what we are proposing here is that it's through this improved emotional well-being at the household level that you see reductions in IPV. And they can either be directly through just the impacts of better mental health or reduced poverty-related stress and strains, or potentially through negative coping mechanisms like decreases in alcohol use. And there's a very strong literature that links the levels of especially binge drinking and harmful drinking to levels and risk of IPV. And at the bottom here, you get one of the quotes from one of the qualitative studies that just give you in participants' own words some of how they articulate how the funding is actually helping the emotional well-being of their families. So the second pathway is actually mediated through conflict. And so this is looking at the possibility that the introduction of cash either can reduce conflict between marital partners, or it may actually increase because the availability of cash could lead to purchase of temptation goods. So things like more gambling, more alcohol use, or the like. And what we see in the literature and from the studies that we reviewed is that there is some evidence of the decrease in conflict in relationships. So 5 of the qualitative studies really, this is something that came out strongly, and it seemed to appear mostly with respect to the least well-off households, so those that were the poorest. And the way it seemed to be operating is you have situations where women are having to negotiate, for example, every day with the husband for the money to go to the market for food that day. And that interaction was a potential source of real stress and tension, especially if the man didn't have the money for some reason. Either he was unable to raise money or he had spent it on something else. And so we're thinking in this pathway that just by eliminating that need for these kinds of daily encounters around access to cash from the man, that there could be reductions in IPV. Interestingly, there's very little evidence that, even though there was a lot of concern that maybe introducing cash into households would lead to some negative behaviors or temptation goods, there's very little evidence of that happening. And so here we see another quote. There have been many fights because children needed many things that we could not afford. I asked my husband and he used to say, there is no money. Then I used to get upset and started to yell. We had many fights because of poverty, not only for us, for all poor. Fights come from suffering. And then the third pathway is what we call women's empowerment. And this is one which it also is very similar to a kind of a bargaining model where women, by virtue of having access to cash, has greater financial autonomy, increased self-confidence, and potentially increased productive investments and activities, that this together catalyzes shifts in power in the relationship. So, theoretically, it could be that she has increased ability to leave, although quite frankly, the ability for these programs to actually provide enough cash that that's a viable option, or it's actually quite low. But it may actually increase her ability to assert her preferences or realize her goals. And what happens is this seems to both theoretically increase or decrease violence, largely in how the partner reacts. So it could be that the partner begins to see the benefits of the added income to the family and sees this as a positive thing and a reduction on stress. It also, though, is common and documented a lot that sometimes partners feel very threatened by this. And there's a lot of concern about the woman usurping the man's proper role as provider. And so this is one which theoretically can go both ways. So here's an example of the quote from the woman who had experienced greater sort of self-efficacy because of the violence. She said, earlier, my husband would sometimes sell household items without consulting me, but now I have my own money. I can have a say on how to spend income. With the money, a woman may buy seedlings for planting and hire an ox plow or tractor or casual labor to dig for her. So then there's been a number of additional reviews since we did the 2018 study, and one that I want to direct your attention to is a study by Baranov. I don't know if I'm saying the name correctly, but in 2020, and it was published in the Journal of Development Studies. And actually, it covers 14 studies, some that, most actually, that overlap with those that were in our own mixed method review. It, though, did two things, offered two kind of distinct contributions over and above what we did. One is they actually did a meta-analysis of the studies, and then also really tried to tease out, using theoretical predictions of a household bargaining model and some of these notions of expressive versus instrumental violence, to predict what would happen if you gave cash to the woman in the household or cash to the man in the household. And what you see in the overall reductions is that there's about a 4 percentage point reduction in physical and or sexual sexual violence, and a slightly lower 2 percentage point absolute reduction in emotional violence. So there's also been some additional studies since 2018 that weren't included in either of those reviews. And what we've done here is we've broken them down into quantitative and qualitative studies. So there's about 8 additional studies and many more forthcoming, some of which you'll hear about over the next 2 days. 50% of these studies show a reduction. And we're also see for the first time a study, and this was one that was an unconditional cash transfer program in Nigeria, which actually suggested an increase in risk as it related to sexual violence at 1 year post-intervention. Intriguingly, though, this same study finds a reduction in risk, actually a doubling of the reduction in risk when UCT, or the cash transfer, is combined with a livelihoods intervention. So, it's unclear from that explicitly, is that just the longer or the greater access to cash? Is it something else about the livelihoods intervention? Perhaps it's a group-based kind of intervention that might be important for the outcome that they saw in Nigeria. There seems to be similar pathways identified in these studies, and a little bit more emphasis on contextual factors, which is good, including kind of family structure and gender norms. So I think more of the kind of work that we are going to need to see in order to take this work forward, to try to figure out what is important and what is can help actually maximize potential impacts on IPV. So the humanitarian settings, actually, though, there's far less research. So the other studies that we're talking about very much are going on in the context of international development funding. And by comparison, what we see in the humanitarian space is a lot more emphasis on the practical how-tos in terms of tools, kits, things to guide actual programming, which is actually a piece that's missing from the development sector. So while there's more research in development, there's more practical guidance in the humanitarian setting. And again, here what you see is a real emphasis on safeguarding across the program cycle. So really concerned that to make sure that cash does not increase risk, and very little actual focus consciously on prevention per se. It's actually, there's a whole work stream, as I mentioned, that is looking at cash assistance as a tool for humanitarian sectors. And this is just a slide. There's at the bottom, you can see a new resource that just came out yesterday, actually, Gender-Based Violence and Cash and Voucher Assistance, which lists the various different tools and guidance and what is in each. And this table here is just the beginning, and it goes on for another page or so, but you can start to see how much is available out there. And many, much of this might be of use to those doing social protection in a more development space. So I want to turn now just to what do we know about the impact of design features on how cash may or may not translate into reductions in IPV. And the short answer is not very much, because we are actually just beginning to study this, and it is an area that I think we need to do a lot more research on. But let me just share with you a couple of findings, a couple of studies that have gone on. So a study in Ecuador that looked specifically at the modality of the transfer. So this was a study in a humanitarian setting, looking at providing food, cash, or vouchers. and looking at its impact on IPV. And what was shown in the study is there was a 30% reduction in physical or sexual IPV, a slightly lower 19% reduction in controlling behavior, but really no difference between the transfer modality. So just one study, but here we don't see a big difference between the different modalities of use. Another very interesting study in Mali started to try to tease out, in an area where we have different family structures, some being monogamous and some being polygamous, whether or not we see any differential impacts of cash on IPV. And what this study showed was that actually all of the reductions that we're seeing were actually in the polygamous households. So in households where there was more than one female partner, there was a 38% reduction in physical IPV, 37% in emotional, and a slightly smaller 23% in controlling behaviors. But it appears minimal impact on IPV in monogamous relationships. So again, showing that we really should not be just looking at average effects in our study. We need to be drilling down a bit along some of these dimensionalities. So I wanted to turn now just to some discussion about what we might be able to learn from the IPV community about components that we could add to our cash transfer programs to potentially increase their effectiveness against IPV. And you'll be hearing later from Shalini Roy about a study that she did in Bangladesh, which was really looking at the sustainability of some of these interventions. And intriguingly, she's finding that the impacts were sustained in Bangladesh only when there was an auxiliary program, group-based program that accompanied it. And she'll go into detail on those findings, but it does raise the prospect that we could both help ensure the sustainability of programs, or in fact, find synergies if we're able to combine cash transfers or social protection programs with some other interventions. So two that come to mind are the idea of facilitated critical reflection groups. We're currently working on a review of all of the kind of curriculum-based group process interventions that are attempting consciously to reduce IPV. And we identified, I think, 76 different curriculum-based group programs. And these have, in randomized controlled trials, been shown to reduce IPV and achieve a variety of other outcomes. They tend to focus on helping people understand and sort of denaturalize gender. So the idea that things are the way they are just because you're a man or a woman, and help people come to recognize that these are actually social and cultural rules. And so the notion that the man is, for example, has to be the head of the household, has to be the primary provider, has right to discipline female behavior. Those types of things are not innate, but actually can be changed. So a lot of these programs focus on that, as well as teaching healthy relationship skills. So communication and emotional regulation. They seem to be most effective when paired with economic interventions. And I don't think we've totally teased this out because what we've seen in a couple of trials that have had 2 or 3 arms is the programs that are built on top of, for example, a livestock asset program or a village savings and loan seem to have a larger impact than those that are standalone. And that could be that you're selecting into your intervention a slightly different group because it's people who are already engaged in some sort of economic activity, which could be a different set of people, or it could actually be the added impact of the economic empowerment component. Another set of kinds of things which could be built upon is interventions that are set out to strengthen either couples, parents, in terms of parenting interventions, or family strengthening in general. And there's multiple programs from the IPV field that show reductions of 30 to 50% in IPV 1 to 2 years post-intervention. So some of these are couples programs like where they meet, and some are new fathers programs in Rwanda. And I'll give you an example of that in a bit. So just speaking about the Indashakira program, this is a couples-based initiative that was tested in Rwanda. It was 24 sessions. And again, as I mentioned, these individuals were recruited from Village Savings and Loan run by CARE. A subset of those couples after the 24 sessions were trained in community mobilization and activism to try to diffuse the learning to the wider community. It also included 14 women's safe spaces at what are called the sector level. So the work went on at the village level, and then villages in the Rwandan system, the next administrative level or 2 levels up is the sector level, and also sensitization of opinion leaders. And if you look at the results of this study, the adjusted odds ratio between intervention and control women who participated in the 24 session couples work is we had the odds of IPV went down by 55% with significant as well reductions in depression, child witnessing, marital conflict going down, and also, as you would hope or expect, increased positive couple communication and increased trust and care. So kind of quality measures of the relationship. So just one last thing is, another thing I think we should be thinking about is the potential to pair things with media and edutainment. So there's been some recent efforts to integrate themes around IPV into various different media and edutainment. This is just summarized, as you can look at it later. One that showed positive reductions that was actually designed for HIV/AIDS and put forward in Nigeria. I think this is potentially a cost-effective way that we could strengthen the programs. And so my final observation is just in terms of where we stand is we still have no studies evaluating cash transfer that are designed explicitly to tackle IPV. So all of this is really, what is happening in the absence of any intentionality. We have very few impact evaluations that are using mixed methods or assess implementation quality. And one of the things that is very clear from the IPV world is that these interventions, their impacts vary a lot based on the quality of the facilitation and the selection of facilitators. And so we really need to be tracking that as well as the design of the intervention. We're getting a few hints that context and the program design are important, but actually very few papers have actually tried to unpack this. And so we need to do a lot more work in that area. There's this somewhat parallel literature on the humanitarian field compared to the development, and they're mostly operational studies. So I think we need more research in humanitarian and more how-to in the development world. So far, we don't have any costing or cost effectiveness studies attached to the evaluation. And that's an area to explore, as well as there's an expanding literature on promising approaches to addressing violence against children, which again, since all of this takes place in family, would be quite useful. And so the final thing I would just say is to remind ourselves about the COVID epidemic and how all of these opportunities are especially important now as levels of violence appear to be increasing, some as exposure or mobility is reduced, and women and men are together in households for longer periods of time. So I will end there, but hopefully that'll give us a good foundation for hearing about the new research that's going on in this space.